So welcome to March 2021 Ripple of Kindness Social, our first webinar. Marianne and I, over the last year, we have pivoted, we have learned new things. We are trying our best to keep everybody connected, and I think everybody feels it. It's hard to believe that a year ago this week, we were all together in a room, drinking wine, eating cheese, drinking water, hugging each other. It's crazy to think how different a year has passed, but we are so fortunate and grateful that our Ripple members have stayed connected and stayed together to continue to support our amazing community, because that's what we need right now. So I think, Mayor, you have some thank yous and welcome to some new members.
Yes, so the first thing is we just really wanted to thank our sponsors. We do have some sponsors this evening. So for those people who made sure that they got their payments in before end of day yesterday, they will qualify for the draw. So Barb has put everybody in one of those spinning wheels. So we will do that momentarily. But our sponsors, so one of our sponsors is the Terry O'Brien Golf Academy, and he is donating 1 week of a half-day golf camp the week of August the 9th to the 13th. And that's a $316.40 value. So thank you so much to Terry and Jen O'Brien. We really appreciate that. Their website is the Terry O'Brien Golf Academy.ca, and their Instagram is at the Terry O'Brien Golf Academy. As far as our next item, it was donated by Samantha White, who is a Monet market planner. And she has generously donated, I have to read this because I don't want to have glasses on because I go back and forth, but our color locking and protective spray, a travel size dry shampoo, black 2-in-1 shampoo and conditioner, intense repair conditioner, and a flexi hold hairspray, all totaled of $150 in that case. It's beautiful. So thank you so much to Sam, and her Instagram is Sam Emma White. So you can follow her on Instagram. And then last but certainly not least is Barb White from BW & Co. The lovely Barb White sitting there. She has crocheted a beautiful hat. I have one of those hats and I absolutely love it. It's part of the Be Kind series, as well as the scarf, and it's the infinity scarf that you can double around, and it's amazing. It looks great and it feels great. So the lucky person who gets that, you will be so happy that you get it. And you can follow Barb on social media at Mustang Barbie 64, and you can see all the amazing products that she's created in the last little while, and purchase some yourself.
A little COVID project, right? A little COVID.
That's right. You have a few.
Yeah.
Sorry, did you do the webinar format and explain the format, Barb, and do the welcome?
I was going to do that next.
Okay.
So just a quick reminder for those that haven't paid, we have about 50 that still need to pay. If you can't remember or you can't find your email, just shoot Marianne and I a text or reach out on rockberry@gmail.com, and we'll send you the payment information again. But instead of doing a Zoom this time and having, hopefully 50 to 60 little boxes, we switched to webinars. So maybe a lot of you know how it works, but you're just going to see our 4 beautiful faces tonight. And you can all sit on your couch and, eat chips and popcorn and drink wine. But along the bottom of your screen, you will see a little box that says Q&A. So if anybody has questions for Heather or Rebecca regarding our donation, or if anybody has questions for Marianne and I about Ripple, just type them in the question and answer, and Marianne and I will read them during the presentation, and then we'll answer as best as we can at the end. So yeah, so that's how a webinar works, little brief 101 webinar. Before Marianne draws the names, we are going to, I just want to quickly give a shout out to all of us, because COVID has been difficult for all of us, whether it's financially, emotionally, mental health, it's just been different, right? And we've all learned to pivot and learn new things. But Ripple has continued to give back to our community. And with this donation, Barry has donated back to Barry. Barry Ripple has donated back to Barry $400,000 in 4 years. So we are, yeah, right, everybody. And then
Absolutely.
Aurelia is at 86,000. Muskoka, they just do it, I think once a year right now, they're at 5,000. So our community, our rock community has now donated $491,000.
We're almost, that's almost $500,000.
$500,000, ladies. Like, you know, if we need a hug, we need to hug and hug everybody, you know, do what you have to do and hug each other, because that is incredible. And it just gives me goosebumps every time I have a little spreadsheet, and every time the donation happens, I watch the numbers go up, and it's just amazing. Yeah. It's just amazing.
Yeah. It's amazing. It really, truly is amazing. So yeah, and we just want to welcome all of our members, our new members that have joined us, our existing members that we've had. We have some guests that will be on here as well. So we just want to say thank you to all for tuning in, because we know your time is precious, but we really feel that it's important that we take this time out to listen to our 2 additional panelists, where they can provide us with all the information. So, but before we get to that, we're just going to go and do the draw.
Okay,
So
so
the first,
I'm going to share a screen.
so she's going to share the screen
Yeah.
with the wheel, the rainbow wheel.
Rainbow wheel. Did everybody see the wheel? Yay.
Yeah.
You can see it. Okay. So, Mare, what's the first
So-
draw we're doing?
The first prize we're going to do for the Barb White hat and scarf. So if you'd like to draw that.
Okay, here we go. Look how fun this is. Oh, I know. Isn't it fun? And the winner is Rosemary Squires.
Yay, Rosie.
Yay.
That's awesome. Congratulations, Rosie. I know, I don't know if she's watching, but that's fantastic.
Rosie, don't worry. So the next one, what's the next one, Mare? What are we doing
The
next?
next one is for the Monet products from Samantha White.
Here we go.
Christine Stewart.
Yay! Dr. Chris. Yay.
Awesome.
Awesome.
Okay, and last but certainly not least is for the Terry O'Brien Golf Academy.
Here we go. So exciting.
Another Christine Dennis. Okay,
Well, ladies, congratulations.
okay, wonderful.
We lost Rebecca.
Uh-oh,
Okay, Rebecca, that's okay. We'll just look for you. Maybe you're back in the attendees. Maybe she's got to log back in.
I wonder, I think her internet might be giving her a few problems tonight for sure.
Maybe solo. Heather, can you do it? No pressure. Ladies, we were chatting for our people that are watching right now. We were chatting before it started, and we were saying, you know, we're going to upload this on our YouTube channel, which has 57 followers. How exciting is that? Well, I don't see her. I'm going to keep an eye on her right now, though, to see if she logged. Oh, there she is. She's logging in under the wrong thing, but hold on.
Okay,
I will somehow let her in. Oh, somebody's dog's barking. There we go. There she is. Yay. Look, we're learning.
so I see that Heather and Rebecca, you're both muted.
There you go, Heather. Heather's unmuted. Perfect.
Okay.
Rebecca, can you?
hear me now?
Yes, we
Yes.
can hear you now.
I'm so sorry.
Okay.
I disappeared.
That's okay, it's technology. This is one of the things in 2021, this seems to be 2021, this seems to be what we're dealing with. So either that or you're on mute. Those are the things, you know, you either drop the call or you're on mute.
And a year ago, Marianne I would text each other, what are you wearing? What are we don't do that anymore because you just see us from our heads up. Doesn't matter.
That's
what.
right. It's business on the top, party on the bottom for me this evening.
Yeah, that's good.
Okay, so it gives me great pleasure to introduce this evening's recipients of the March donation for Ripple of Kindness is the Royal Victoria Regional Health Centre's Breast Imaging Department. So today we have Heather Gillis, who is the Operations Director, Medical Imaging and Laboratory Medicine. And we have Rebbeca Truax, who is the Director of Philanthropy for the RVH Foundation. So thank you both for being here. We're so grateful for you to come and give us your time and explain to our members how this money is going to be used in our community. I can speak for, I think, all of us here on this, this webinar right now that we all utilize the breast imaging department, especially at our age. So we are so thrilled to be able to have you here to speak. So without further ado, I'm going to put the floor over to you and we will gather your questions and then we will address those at the end of the presentation. So welcome, ladies. Thank you.
Thank you so much, Barb, and thank you so much, Mary Ann. It is a true pleasure to be here to share with you how your gift is going to make a tremendous difference in the lives of our patients at RVH. And I also want to add how grateful I am to be a member of Ripple of Kindness, Barry. It's been a true privilege to get to know all of you and to feel part of such something so large and so meaningful. So thank you for that. You know, community and RVH are so tightly connected, and really since the beginning, when 124 years ago, a group of women volunteers raised funds for the first 4-bed hospital. Your gift is really becoming part of this amazing tradition. And with an exploding population growth and healthcare needs rapidly growing, RVH is dedicated to ensure that we are there for you and your family in the moments that you need us. In order to meet the demand, we are planning now with a 20-year master plan that will see significant expansion at our current site and in South Simcoe. It's a bold plan that is a plan that will meet the needs of our growing community and continue to provide exceptional care. And it's a plan that will require the entire community to mobilize. I'm so grateful for those who are helping lead the campaign. And the campaign is appropriately named Moments Matter. And the incredible leadership, first of all, of Mary Ann Frith, who's co-chairing with Steve Blanchett, as well as other Ripple members, including Marta Duvenborden, Dale Pickard, Estelle Kings, Kelly Whitaker, Karen Biles. Collectively, they are making such a difference. And I also want to welcome Pamela Ross, who's our new foundation CEO. And she's also joined Ripple of Kindness in Barrie, so we're really thrilled to have her leadership. The Ripple of Kindness donation is so important because it demonstrates the power of people coming together. And in order to recognize this gift, we are going to be installing this sign in the change area in breast imaging. I hope everyone can see that okay. Oh, is that better? Okay. And it's so important because this really is going to be in an area that every woman receiving a mammogram can see that they are supported by Ripple of Kindness and other women. So thank you so much. And it's really my pleasure now to turn it over to Heather, who is not only an amazing member of Team RVH, but I consider her one of my dearest friends and probably one of the most passionate people about healthcare. So Heather, take it away.
Thank you so much, Rebecca, and thank you to all the members of Ripple of Kindness. I'm just smiling so much because it's so joyful to see the community giving back to our department in particular and to RVH. There's something magical about this community, and just I almost have shivers listening to hear the collective, what you've done to raise money for your community and my community. And it's really empowering to see women doing this, and especially during the last 12 months of COVID, healthcare workers and the journey and the support that we've had from all of you and members of our community. So breast imaging is the cornerstone of our Department for Early Detection of Breast Cancer. Everyone, I was happy to hear Mary Ann say we've all had mammograms. That was going to be my plug this evening to say, I hope you encourage all women over the age of 40 to get their mammograms. We have the journey at RVH where screening is key to early detection of breast cancer. And if you do get diagnosed with breast cancer, the journey of all the technology and the cancer therapies that are required are here at RVH, and that journey is all done in our community. And having that, you hear us talk about it all the time, care closer to home, that's so important. And I'm personally passionate about it because I think if I talk to each one of you, we know 1 in 7 women have breast cancer over the age of 20. I have a mother and a sister. It was early detection that has saved their lives. Not once, but twice for my mom and once for my sister. And it's amazing. So every 7 years, we have to replace our equipment. It costs a lot of money. People don't understand that the government doesn't fund the foundation of that technology. So it's millions of dollars. We have 4 machines right now that are required for replacement, and what we call a prone biopsy table and some other ancillary equipment. So we're looking for millions of dollars to do that. We are what's called a high-risk breast imaging center. So again, that journey of having not only the mammography equipment, which is the gold standard, but if you require the biopsy with ultrasound, or for women with high density breasts, they have to have an MRI biopsy. We have all of that technology. We're fortunate because we have great relationships with some of our vendors. We were the first in Canada to get a special breast imaging coil and MRI to be used in the country. We're a show site for them, so we know the quality is there. We're fortunate that the leadership before I joined RVH, we have our Canadian Association of Radiologists mammography accreditation program, which ensures our standard for peer review of our physicians and our technologists. So again, we do 100 women a day, so over 20,000 breast screens. We're comparable to some regional centers like London Health Sciences Centre, the Ottawa Hospital. Our technology has something that's called tomosynthesis. So the upgrades will allow us to have new software, and the equipment's tired. So it's again about making sure we get those microcalcifications that we can detect that cancer early so that we can save lives. So from the bottom of my heart, and for those thousands of women in our region that are being screened, and for those that require treatment, there are not enough words in my heart to say thank you. It means so much, and I'm so proud of you guys, and I'm looking forward to becoming a member. I'm going to pledge that right now. So thank you very much, and happy to entertain any questions. I could talk about this for a long time. So.
That's amazing, Heather. Thank you so much for giving us that information, because I think oftentimes there's the bits of information that people don't understand or are not aware of, and that is that a lot of the community or a lot of the equipment is the responsibility of the community. And that was one thing before I had anything to do with RVH or this campaign. I had no idea that that was a responsibility of the community. And again, I learned something new this evening. I had no idea that the equipment has to be replaced every 7 years. Like, I mean, again, when you go in there, the equipment looks perfectly fine. It looks like it's brand new, but the technology itself, it's like our cell phones, you know, we upgrade our cell phones every so often because technology changes. So why wouldn't we do equipment that is so incredibly important in life-saving imaging like that?
No, thank you very much. Yeah, software, the engineering, the physics, the design of radiation dose, those things change over time. So we'll have the latest and greatest, and 5 or 6 years later, there'll be something new on the market. But, you know, you could just roll back 100 years of how medicine was practiced and what we have today. So it's an incredibly exciting, I have a biased opinion, exciting profession to be in, with the combination of engineering, mathematics, physics, healthcare, all of that combined together. So.
Right.
Again, thank you so much.
It's great what you said about everybody over 40 should have a mammogram. You know, it's something that you think everybody knows, but for instance, today I was on social media for a little bit and I saw Arlene Dickinson just went for her very first mammogram. I'm not sure how old she is, but that's crazy, right?
Yeah.
I think every woman would just know to go, but you just put it off and put it off and put it off, right?
And it's really an easy test, right? Not to interrupt, sorry, but it really is an easy procedure to go through. It's uncomfortable for a few seconds. And again, as technology and as we replace the compression paddles that are used on the equipment, make it more comfortable for women as well. So those are important factors.
Heather, we have a question here. I'm just going to put it out to you. So we've heard so many women who have missed or skipped a mammogram during COVID-19, this individual included. Does RVH have a plan to manage getting us caught up?
That's a fabulous question. And yes, if you recall in wave one, the government of Ontario actually had asked, we had to shut down our outpatient services, and that was collective across the province of Ontario. In that short window, when we scan 100 patients a day or 80 to 100 patients a day, until we were able to ramp back up legally in August, we had about 5,000 women in our region that required to have their mammogram. We had investments added so that we could add hours on into the evenings. And we've also added on a couple of shifts on a Saturday so that we can get back up to that daily volume. But we also have to be mindful of our spacing of patients, cleaning in between. Not that we didn't do that before, but with COVID, we can't have our waiting room.
Oh, you froze there for a minute, Heather. Well, we'll
Rebecca,
see what happens here.
So yes, basically, there is a bottleneck that they're working through, but please continue to book and to pursue, because we will.
Oh, sure.
Oh, and there's Heather again.
Wow, I'm so sorry. I usually have pretty good stability here. I apologize. So we have a lot of safety measures in place for women. So we try to reassure them about coming in, but it is important because when you statistically start looking at thousands of women who did not get screened during that window, there are some in the region that have breast cancer that hasn't been diagnosed yet. The hospital also kept very proactive with their cancer surgeries as well throughout this as much as they could. And they have a ramp up plan that started now as well, but that's been impacted by wave 2. And there is some concerns about the new variants and what that will mean with wave 3 and potentially wave 4. But I think the hope that we all have is that vaccine access is starting to get better. Everybody, I'm not the physician, but I'll put the plug in, get your vaccine. If it's offered to you, get it done. That's going to help prevent you from getting really, really ill.
Absolutely.
We have another question. What age should someone get a mammogram if they have a family history of breast cancer?
Well, they should definitely, I know Dr. Stewart's on the line there, but they should be talking to their healthcare provider. But I'm someone, I'll use myself as a personal example. I started my screening after age 40 because of the family history. So really important to do that. Also, women with high density breast tissue. That's the other blessing. We have really great MRI technology. And I always like to use the example of one of the leading breast imaging experts, Dr. Carol Denny in Ottawa. It's kind of like looking for a snowball in a major snowstorm. So mammograms are great, but when you have high breast dense tissue, MRI is something that we do for high risk women as well. So that's an important thing, and people shouldn't be afraid of having that test done if it's recommended by their provider. But
well, I know when I had my first mammogram, there was a little scare. So they whisked me right off to ultrasound, and it was just density issue.
That happens a lot. I've been there myself. It's scary for women, absolutely. But
we have another question here. From which communities do the women are treated at RVH? Where do they come from?
Mostly within the catchment area of Simcoe Muskoka, for sure. We have the only MRI scanner. There is no other in what we would call our former LIN, which is the North Simcoe Muskoka LIN. So any of the high risk screening would be done here for it. Perry Sound down. Newmarket obviously has the other institution that would have the CTs and MRIs and things, but the smaller hospitals here will do mammograms. Some do, some don't, but to do that full spectrum high risk screening, RVH will look after that 500,000 catchment area of North Simcoe Muskoka.
Wow. So just to go back to the one person that had the anonymous question of they were bumped during COVID, would that individual be responsible to call the hospital or call their physician, or how would they go about maybe perhaps speeding up that process?
Absolutely. If they're concerned about they haven't been contacted, because all exams, not just for mammography, but when we had to ramp down other services, our physicians would go through requisitions and actually do the triaging of cases. That we did still do some high risk women during that time period, but it was compared to what we would do on a daily basis, it was very little. But for sure, they can call RVH Imaging Services into our bookings line. Don't be afraid to advocate for yourself. Call your family doctor as well. We're happy to follow up on that. We try very hard to make sure we still have all that paperwork in place, but you know,
For sure.
we want to make sure that women are safe, and it doesn't hurt to pick up the phone and ask.
So we have another question. Can you tell us about breast reconstruction surgery at the same time as lumpectomy?
I'm going to have to defer that. Dr. Renee Hanrahan is one of our breast surgeons who's an expert in that area. So I know that she's a leading breast surgeon in Ontario, and we're lucky to have her at RVH. But I'm sorry, I don't think I'm qualified to get into the details of that breast reconstruction portion of it. So. But you should bring Renee. I'm sure Renee would love to come and talk to the team sometime. She's amazing. Yeah.
Yeah, no, that's for sure. We can, I'm sure we can always do like a guest speaker series as well, which would always be so helpful, because I find that this is information that, you know, we all need to talk about. It affects all of our lives. So I think having these candid conversations and being able to have a resource in yourself, Heather, as well as anybody else at the hospital, would be so great to have.
Yeah. And one thing too to remember, which I learned from being on the board at Gillis, is that breast cancer is for men as well. It's
Absolutely.
not just women, right?
Yes.
Yeah.
And that's why it's called breast imaging, not women's imaging. It used to be called women's imaging, did it not?
Yes, that's
Okay.
exactly why. Obviously,
Okay.
our major catchment is women, but yes, men with breast
That's
cancer.
happened.
And you
For
should
sure.
keep getting your mammograms as long as your doctor says that you should have your mammogram.
Oh, so you see that question?
Yeah.
Okay,
Yeah, that's good.
perfect.
We had a lovely comment from Mary saying that all of our members should encourage that anybody over 20 with the history, because I wouldn't have known that the age of 20, 1 in 7 stats, it's crazy, right? So
1 in 7 women over the age of 20 now have breast cancer. So
Mhm.
consult
like
your
I would
physician.
never have thought 20 was the age.
No,
No kidding.
that's just a statistic that yeah, I mean, it's very rare that you would see it in the 20s, but yeah, unfortunately, we all have probably personal stories of women in their 30s and 40s, but yeah.
And is there a number that they can call for, or just call their doctor? Like what would be
They
the
should
best
go to,
number?
you should always loop in with your referring physician. The Ontario breast screening program, you do not need a referral over the age of 50. There has been lots of advocacy in the world about breast screening should be without a requisition as of the age of 40. That is not the case in Ontario. So you could come and book your own, or you could book your own appointment if you're age 50 and over as part of our Ontario breast screening program. But under that age, you are required to have a requisition from your medical practitioner.
And if you have a mammogram and it's clear, what is is it a 5-year, like, or is it a 2-year? What's the recall?
2 years. Yeah. And if you're high risk or they're monitoring something, you could be back in 6 months, you could be back in 12 months. Everybody's a little bit different.
Right. And I have to say, getting the standard letter from the province is so comforting to know that, you know, and it was the same thing when I turned 50 and I got the screening for the colonoscopy part of things, right? So I was like, awesome. So you know you're getting old when. So it's great that they do have the screening process where you get that information sent to you. It's monitored. You just it's easy follow through, which I think is a fantastic thing for many people who can become forgetful or don't necessarily go to the doctor as often as they should.
I always like to tease and say 50 is the new 40. So
it absolutely is.
Barb, I was going to say that we're going to be sending out, for those people who couldn't be with us tonight, we're going to send out some information. So we'll just make sure that phone number is included that Heather mentioned for those over 50.
Perfect.
Awesome. And do you have that video that you're going to share?
And I think, you know, it's the best person, I think, actually to relay the message also always is the patient. So we have a video that I'd like to play for you. I'm just going to go ahead and share my screen if that's okay. And oh, it says my host has to allow me to share.
You want me to allow you to share? Okay. I'm gonna do that. Let me just see how I do that, Rebecca. I'm learning.
Oh, I do.
Okay, you should be able to share now.
Awesome.
Here we go.
Is that playing?
It's playing, but there's no sound, Rebecca.
Would you like me to try, Rebecca?
Just, I think I might have to. Okay, just sorry.
Hi, my name is Esther. I'm a breast cancer survivor, and I'm proud to support patient care at RVH. My family and I, we live in Innisfil. I have a 6-year-old son, Mika, and my husband, Fuad, he works in Barrie as well. In the summer of 2017, so just 3 years ago, I had just turned 37. I had a 3-year-old boy at home. I felt this little lump in my breast and went to my family doctor and said, you know, my mom had breast cancer. I think we should maybe check this out. And she said, you know, I think might be a cyst, but yes, to double check, we will send you to the imaging department at RVH. So it was scheduled right away, which I really appreciated because, you know, at that point I knew there's something not right and something has to be investigated. I remember the moment when she said, yes, you have breast cancer. And I couldn't believe it. But at the same time, I was so happy and grateful that I found it myself, that RVH did everything they could to process me quickly. Within 3 weeks, I had my surgery scheduled. And that was very comforting for me because I just wanted the tumor out of my body. It's really special to feel so cared for, especially when you are in a position when, you know, your whole world is upside down. You have a 3-year-old child playing at home and you have to think about what am I going to do with him when I have to go to chemotherapy. I remember asking the oncologist, what about the chemotherapy? What about the radiation? Will that be done here at RVH? Do I have to go to Princess Margaret? And she said, no, we have the radiation department in the basement. You can just come here. And I was shocked because I didn't know anything about the cancer center. I didn't know that all of this was available to us patients here. But everyone from the oncologist to the staff and the technicians, they were very compassionate, they were kind, they knew exactly what I was feeling and tried to help me every step of the way. The biggest lesson I learned from all of this and my journeys here is that when you're healthy, you don't consider that one day you might have to use the cancer center. You might have to use a MRI machine. You might have to seek somebody in the cardiology department. You don't know. You can't predict these things. But then in the moment when you need it, then you'll be like, oh, do we have this in Barrie? Can I do this in Barrie? Will I have to go to Newmarket? Do I have to go to Toronto? What is the next step? And to know that you have access to a high level of care, of equipment, of professionals, as in doctors, nurses, and the staff who navigate you through everything. And that's something you only realize you need when you're sick and you're in need of it. So please support our hospital. You might not think you need the help, but one day, you know, all of us will either be born here or have to seek treatment or get a second opinion. There's a lot of amazing specialists at RVH. So yes, please consider donating.
Wow. Wow. What a story, eh?
That was so impactful. It really, truly is. When somebody speaks from the heart, how it affected them, it's absolutely amazing. Thank you so much for sharing that.
You're very welcome.
Well, I think that's everything. I don't think that there's any other questions. Do you see anything else?
I don't, but we're going to do the virtual check presentation, ladies. I'm going to try to back up far enough.
Perfect.
No more.
Thank
no more.
you.
Ready? Here we go. Yay.
Perfect. You're set.
Oh,
Go on your tippy toes, Barb, so we can see your face.
oh,
Thank
that's
you.
great. Well, we're thrilled. We're so thrilled to be able to help RVH and women helping women, right? That's what it's about. Does anybody else have any last questions before we stop recording and log on?
No, the only thing I want to add is that our June social is June 11th. So I suspect it's probably going to be the same format. We don't really know what's going to be happening, but I can't imagine us meeting anytime soon in a large capacity. So we will definitely keep you posted with regards to the details for that. If you're on this webinar this evening and you have not made your payment, please do so. So then that way we can get this wrapped up in good time. But other than that, I think that's everything.
And let's hope in September, it'll be our 5-year anniversary. So let's hope we can all get together in September.
Absolutely.
We all need a good party, right, ladies?
That's right. We do. Okay, everybody. Well, thank you again so much for tuning in. And thank you, Rebecca and Heather, for coming and sharing all of those words of wisdom to us and to our members, because it was really, really good, impactful information. So thank you.
Thank you.
Thank you.
Don't forget to ripple your kindness, everyone. It's important.
Okay. Bye, everybody. And Jody Martin is saying she'll host. Yay, Jody.
Oh, Jody. Okay. It's
Love that.
recorded, Jody. You can't back out.
That's right.
Bye, everyone.
Bye, everybody. Take
Good
care.
night.